Okay, so I wanted to talk a little bit about how to manage medications after surgery. Now this is going to be different for everybody. It's going to be different for the different medications. Just as a general way that I particularly prescribe for patients is I'll give you two different types of pain medication. One of the pain medications is going to be a narcotic that has a little bit of Tylenol mixed in. That's typically going to be a medication like Percocet or a Norco. And then I'm going to give you a rescue medication to go in between just in case you need that. The reason we do it that way is that the Percocet and the Norco have a little Tylenol mixed in, and that helps make them a little bit stronger, which is great. The problem is that Tylenol can be toxic if you take too much of it. And so I'll typically give people a little extra medication to go in between doses of Percocet. So let's say you're taking Percocet every 4 to 6 hours, and 2 hours go by and you're starting to have more pain. You can't really take any more Percocet. That's what that medication is for. It's called a rescue medication. It's going to be typically something like an oxycodone, and that will go in between the doses to try and help you through it. And you need to be very careful with this. That's a lot of narcotic, and you need to be making sure that someone's watching you and that you are okay tolerating that. A lot of people want to know when they should start their pain medicine. Most of the surgeries that I do, we're going to use a nerve block. It's a little hard to predict how long the nerve block will work. In the nerve block, the anesthesiologist will put some numbing medicine around the nerve up in the neck, and it makes the whole arm go numb for somewhere between 12 and 36 hours. Now, trying to guess when that's going to wear off is a little bit difficult. I typically tell people that when you go to bed that night, you ought to take a little bit of pain medication, just because you never know when it's going to wear off. And if you have to go from 0 to no medication when the pain fully comes on, that can be a little bit of an uncomfortable time. A lot of people also want to know how long they need to take their pain medication for. That's really a very different answer depending on who you are, how big the surgery is, how much pain you're having. Some of the smaller surgeries may be a very short period. Some of the bigger surgeries will be a little bit longer. I think you should talk to your doctor a little bit more about how long they think that is. A lot of recent research is really showing just how addictive these are. So you want to take the minimum amount that you can. And generally I would say for most of my shoulder surgeries, it's not uncommon for people to be on it for a couple of weeks. Some of the common side effects of surgery, both from the anesthesia as well as from the pain pills that we use afterwards, are number one, constipation. So typically I'll be prescribing something like a Colace, which is a stool softener to try and help with some of the constipation. And for people who really have a hard time with it, also not a bad idea to use a medication like Miralax. Okay, so this is a generic form of Miralax. Picked it up at Costco. Relatively cheap stuff. It's available over the counter. This stuff is really good for helping with constipation after surgery, especially from utilizing pain pills. The way you take this is you just unscrew the cap. You put one cap full of the material, and then you put it into a drink. It'll dissolve in just about anything, and take that whole thing down. And usually it's going to be once a day. For really bad cases, sometimes we'll do twice a day. So some of the other very common complications from pain pills and surgery are nausea. Typically I will send patients home with a nausea pill that can be taken as directed. There's a couple different ones that we use. Another very common problem is itching. Not everybody has to deal with that, and hopefully you're not one of them, but if you're having a hard time with it, this is just over-the-counter Benadryl or diphenhydramine, and this will actually help with the itching, should that be a problem. Final medication that's pretty commonly asked about in surgery and after surgery is non-steroidal anti-inflammatories. This is a little bit of a tricky issue. There are more than a few studies that show that non-steroidal anti-inflammatory medications such as ibuprofen, Advil, Aleve, diclofenac, that these medications can act counter to your body in terms of healing. Typically after a big repair, I'll ask people not to take anti-inflammatories for a month if that's possible. Now if you haven't had a tissue repaired to another tissue, sometimes you're able to take that a lot sooner. I would say ask your doctor about that. I'm frequently asked about driving after surgery. And the reality of this is that there's not a real specific rule. It's generally more of a common sense thing. There are two big criteria that I tell my patients. Number one is that you can't be taking any pain medications while you're trying to drive. That's actually driving under the influence, and you can go to jail for that. The second thing is you have to be able to safely operate the car. Now that's going to be a different answer for every person in every car. You are allowed to drive in a sling as long as you can safely operate the car. I will tell you though, if you get in an accident, they're probably going to blame you. So you want to really limit what you're doing and make sure you're very safe. Many people ask me after surgery how much weight they're allowed to lift. And again, it's a different answer for different problems and different surgeries. But a good rule of thumb is if you're in the sling, you probably don't want to lift more than a cup of coffee. Keep the weight very low. You have to keep in mind that everything is connected. Everything that goes in your hand, all that force has to transfer up into your shoulder. So while it might not feel like you're doing much if you keep your elbow tucked in and you can lift something heavy here, the reality is all that force does get transmitted through there, so you want to keep it very light in the hand. Okay, so prior to surgery, in preparation for having the surgery, there are two things that we commonly talk to people about. Mostly it's about trying to avoid infection after the surgery. The reality of most infections is that when we have surgery, the bacteria that infect us come from our own bodies, either on the skin or from your local environment. So two of the things that I've suggested for patients is, number one, to use a benzoyl peroxide wash. This is a 4% benzoyl peroxide. I just got this off of Amazon. I don't think there's anything special about the brand. It's just it needs to be a benzoyl peroxide wash. And the reason for this is there's a particular bacteria that lives in the pores of the skin that is sort of notorious for bothering people after surgery. This will open up the pores and allow the water and the soap to wash out everything that's in those pores. I'll typically have people use this, say, in the shower for a week ahead of surgery if that's possible. The second thing that I frequently will have people do is a HibaCleanse wash. And a lot of times we'll have little wipes that can go on the shoulder to try and help kill all the bacteria in the shower. You're going to want to do this a few times a day. This is one that I bought actually from Costco, just a local pharmacy. It's a 4% solution. And the basic concept here is that you want to rub the area with it. Some people will take a whole shower with it, and you want to let it dry if you can. And then once it's dry, Okay, so another common discussion after surgery is what to do about the dressing. Okay, when we do the shoulder surgery, a lot of the shoulder surgery will continue to sort of ooze and bleed afterwards. And so we put these very bulky dressings on. Even though a lot of times the incisions are very small, we'll put a very bulky dressing on there. Typically what I'd like you to do is to leave that alone for 2 days. That's a sealed up environment, and I really don't want anything kind of messing with the incision. After 2 days, you can pull that whole dressing off and throw it in the garbage. You don't need it anymore. After that, particularly for the scopes, all you really need is just a regular old Band-Aid. Stick it right over the top of the incision, and what that will do is keep the clothing and things around you from snagging on those little incisions, which can be irritating.